I'm an orthopedic surgeon that's fellowship trained in hip and knee, both reconstruction and also hip preservation. I grew up outside of Waco, Texas in a town called Hewitt, and grew up on a ranch and learning the value of hard work. I was fortunate enough to train at Mayo Clinic. After Mayo, I did a fellowship in hip and knee reconstruction, but also hip preservation. I wanted to have my arsenal to be able to attack a problem with all the different ways to do it. I love just enjoying Colorado. My whole family is really good at skiing. We love to fly fish during the summer and go on hikes. It's just good family time and relaxation. I have a really expansive patient population in that it goes all the way from 9 years old to 99 years old. I get to help a lot of athletes out. The question of being, why would somebody choose hip preservation over hip replacement? At the end of the day, it is how is your joint functioning and how good is your cartilage? And it's based on how the joint looks when you're in there with a camera, how the MRI looks. And so if there's any evidence of arthritis, I'm gonna tell a patient, like, maybe we should just hold off until you get a hip replacement. If the joint is good, we should save it. My credo is to treat every patient like I would my own family. And I mean that very sincerely. But it's just being very honest with the patients and transparent about what we can and can't do. It's shared decision making. At the end of the day, you're asking for my opinion. Like, we want to make a decision together and share that decision making. HCA Health One Swedish has been a really good partner for me in the patient care. There are patients that do their research or already know about what I can provide, and 30% of my patient practice flies from other states. At the end of the day, I want you to have exceptional care to ensure that the patient experience and the outcome is all delivered.